What is an example of health systems transformation from a complex systems perspective? I'm Dr. Chad Swanson, and I'm an emergency physician, and I'm on a journey to understand and transform our health system. Today, while I was outside doing some exercising, I was listening to a podcast, which I often do, and the podcast was from the Ripple Foundation, and the podcast is called Unsung Stewards, and it highlighted Tanya Wellens of the Greater Washington Community Foundation. And I thought it would be worthwhile to describe how I see this organization applying complex systems, ideas, and perspectives for transformational health systems change. Let me first review the current health system as I see it and the transformation to an ideal system. So this cartoon here represents, in my mind, the current health system, which was established over 100 years ago, wherein we have a variety of subsystems. Clinical medicine might be one. I'm an emergency doctor. I work in the hospital. We work with nurses, and we have short-term objectives primarily to care for patients at one episode of care, and we have short-term metrics and incentives. Another subsystem might be health education, wherein there are also short-term metrics based on graduation or in academics, publishing papers or getting grants. Another subsystem might be public health organizations, wherein the short-term objectives might be obtaining grants, finishing projects, etc. Businesses might be up here, and their short-term objectives might be to obtain profits. So in this model, each subsystem is working for its own short-term goals without adequate consideration of the larger system. This might represent an ideal health system, wherein all of the subsystems still have their boundaries and their short-term goals, but there's more collaboration, there's more merging of the subsystems, there's more feedback between the systems, and there's kind of a banner here that represents two things: aligned incentives and a shared vision. So all of the activities of these subsystems within a community are working towards the shared vision of optimal health and well-being for all at the lowest possible cost. So as I was listening to this podcast just an hour or two ago, I began to see a lot of these ideas. And so let me just share the takeaways that I gleaned from listening to this. Let me just first share that I have absolutely no connection, no conflict of interest whatsoever with either the Ripple Foundation or the Greater Washington Community Foundation. I've never communicated with them at all. So the Ripple Foundation is perhaps the organization that I think applies complex systems ideas for transformational change in the most effective and visionary way that I'm aware of. So as far as I know, the Ripple, so let me just share a little bit about the Ripple Foundation. This is their website. And on the About Me page, it says, transforming the future of health and well-being together. So there's some important ideas there. One is the idea of transformation, which in my mind represents significant fundamental change from one reality to another. The future of health and well-being, so that's quite broad. So we're not just talking about a clinical encounter, we're not just talking about a project, we're not just talking about an educational requirement, we're talking about the health and well-being of a population. And then the idea is together. So in order to accomplish health and well-being, we have to do it together. And as we think about those models there, we're already disrupting the current model of working in silos or fragmented, and we're already starting to think about how we can accomplish the vision that we all want, health and well-being, together. So then says, imagine a world where everyone thrives. So what I'm hearing and seeing in that statement is the importance of a shared vision. So we can all get excited, I think, about the idea of a community or a society where everyone thrives, where everyone has the vital conditions they need for equitable health and well-being. The Ripple Foundation partners with stewards across the country to explore innovative thinking and action that can make this vision a reality. So this foundation focuses on the idea of systems stewards. I love that concept. The idea that there are stewards for the entire system. Now, as an emergency doctor, I'm a steward for my patient that comes in, for my emergency department, but throughout my education and training and practice, there's little to no emphasis on my role as a systems steward. There is occasional focus on that, but the incentives aren't aligned around that. The stories that we tell, the heroes that we hold up, the job security that is provided is not based on someone being a system steward. So I love that idea. So this podcast highlighted the Greater Washington Community Foundation, a foundation that I wasn't even aware of 3 or 4 hours ago. So this is completely new to me. So I'm not necessarily holding up, or I'm not at all holding up the Greater Washington Community Foundation as an example or as a model of complex systems thinking for transformational change. It very well may be, but my goal today is to just provide an opportunity to think about an organization through the lens of complex systems thinking for transformational change. And what are some of the things that they said or that they're doing that might fit into an example or a model of a successful organization. So just a little bit of an introduction for this foundation. They say for over 50 years, the Greater Washington Community Foundation has been a champion of thriving communities. So again, it's this broad vision of thriving for a group of people and a catalyst for community change, made possible through local philanthropic engagement, effective community investment, and civic leadership. Then as we scroll down here, they advise and partner with donors, advisors, companies, nonprofits, and the community to build a legacy of thriving communities. So in my mind, we can already see this idea of working across the boundaries, across sectors, across organizations to accomplish what we really want, which is thriving organizations. So as I listened to that podcast, I wrote down some key ideas, and I'll try to share these ideas within the context of complex systems thinking. And I hope that we can also, I try to think, okay, how can I apply these ideas within my emergency department work and within my education and advocacy work related to complex systems thinking. Maybe you also could think, okay, where do I work or where do I have an area of interest? You might be an advocate for mental health. You might be an administrator in a hospital. You might be a mobilizer in a community for equitable health outcomes. I hope that as you think, what's my subsystem? What's the shared vision for the community? And how can we better collaborate to accomplish that goal? So one idea that was shared was the importance of sharing data. And I see this. So too often data is perhaps I saw this in COVID, for example, the data is the public health organization in a community has a certain amount of data. The universities have a certain amount of data. That's not necessarily shared throughout organizations to rapidly adapt and respond to community health needs. And they presented that idea with as a high leverage point. So that's and this is an idea that's important in complex systems thinking. So where can we intervene in a way that's going to transform the system from the current state to an ideal vision? And sharing data was one that seemed to be presented. Another idea was the idea of health in all policies. So as we think about policies, legislative policies, how does transportation policies or education policies or housing policies, how do they impact health? They talked about the importance of innovation. They talked about the foundation being set up as a catalyst and as a connector. So again, this idea of breaking out of our silos and our boundaries and organizations to work together, connect with each other, collaborate with each other. They discussed and talked about the vision of collective well-being and thriving together. They focused more on impact as opposed to what's always been done. So how can we change? How can we adapt? How can we be nimble in the way that our organization is set up, in the way that funding is provided, in the way that education is performed, in the way that professionals are licensed, et cetera? How can we transform any of those ideas that we've always, how can we transform the way that things have always been done for impact? There was a discussion around paying for people with lived experience, so experts in lived experience. When we think of the word expert, we often think of someone with a professional degree or someone who has accomplished goals in an academic or a business setting, whereas there are experts in communities as it relates to health and well-being that are connected to neighbors and families and are knowledgeable about the local community, and they can and should be elevated, recognized, paid financially, etc. There was a discussion about aligning a vision and a discussion about there being no blueprint. So I'd love your ideas. What is your subsystem that you work in? Are there examples of connectors and collaborators that are helping to align all the various subsystems with a shared vision for thriving and well-being long term? Now, this is one example of a daily video that I'm sharing. I'll be doing this every day. And the idea is to have an informal conversation about complex systems, approaches, and ideas for transformational change. I'd love your questions, your ideas, your criticism.